Okay, hi guys. Hi. So I've had a productive appointment with the doctor today, so that went well. Hoping for better outcomes. Okay, now I want to respond to two types of comments I see on my, on my pages. So one is teachers should be taught more about autism, and yes, I agree with that. I agree with that. However, I do have concerns because already the education that is in the mainstream about autism is not enough. The education about autism that is out there is not, it misses the vital facts about what autism actually is. It's missing that. The education that is being taught about autism is based on the medical model, and it leaves out vital information of what autism really is. Therefore, it means that we will not get to the bottom line of the types of interventions and the help that our children will actually benefit from when it comes to autism. However, on the general scope, yes, teachers should be educated on autism in general, but that is the general basic training for autism. However, I believe that autism can go into depth of, if we want to actually unpick the actual underlying issues going on when we are saying autism, when we talk about that umbrella term called autism. The other post is that it is, people are sort of talking about separating the diagnosis or the diagnostic criteria from people who have that high level autism, where they are completely dependent, they need support, separating it from the other people who are, just autistic, but everything is like normal. They can go to work, they can express themselves, they can talk. They're pretty much independent, but then just occasionally have a few breakdowns here and there. So some people are talking about separating the diagnosis or the diagnostic criteria, which I agree as well. But I don't feel that the issue is about separating anything, because it's like we're going around in circles, but we are not addressing the elephant in the room. It's like we're still doing that thing where we go around the issue, where the actual issue is being ignored. Now, I'm sure by now you already know my stance on where I stand and what I firmly believe, or the underlying issue when it comes to autism and causation, right? So, I'm sure you already know that my stance is that the toxic ingredients that are put in vaccines are the ones that induce all the different type of symptoms and presentations that are then classed as autism, which is like an umbrella term of all these different elements. Okay, let me try to simplify that. What I'm saying is, autism, right, is an umbrella term for different presentations that can be seen in someone who is said to have autism on a high level. I don't know about someone who is fully independent, if it even is the same thing, because as far as I'm concerned, I don't believe it's the same thing. I think definitely there should be some kind of a distinction between people who are very independent, people who don't need 24/7 support, versus people who are not aware of danger, who are not safety aware, who need 24/7, people who self-interest behavior, people who need so much support in different areas of their life. They don't speak, they can't communicate verbally, all that extra support that is needed. I think that we are missing the underlying issue. And the toxic ingredients that are put, I want to talk about two main ones today. Two main ones which have been really, stirring the pot. These two main ones that are aluminum and mercury. We heard President Trump. It's like I'm singing a song. He said, I'm saying this over and over again. We had President Trump talking about, well, we want to get these out. We are working on getting them out. The thing is, if you're still working on getting them out, it means they're not out yet. It means they are not out yet. So there are the non-live vaccines, the non-live ones, which are like the Hep B, the Hep A, the DTaP. I actually posted that earlier on off the top. I can't remember them off the top of my head. Those are the non-live ones, and they still contain aluminum. They say that the amount of aluminum in those vaccines has not been proven to be unsafe. But has it been proven to be safe? They say it's not been proven to be unsafe. Yet there are so many children developing autism or autistic traits after they have these vaccines that contain aluminum. So what is considered a safe dose, a safe amount of aluminum? And how do we know if they say they put maybe 5, they didn't put 50? How do we know that they're actually honest enough to do that? Should we be basing it on trust? Or better still, why do we need aluminum in the vaccines in the first place? They say that because it is an adjuvant and it's beneficial to stimulate something. That's more scientific, guys. I'm not there yet. I'm not going deep down to that. But they're saying that they need it as a relevant ingredient to stimulate some kind of a response in to make the injection more effective when it is injected into the baby or the child. However, I believe that they are sticking to their story. They are standing with their narrative, with their science, and everyone else has to sort of accept it despite what happens afterwards, despite the fact that after your child is given the injection with the aluminum, the child could develop encephalitis. Now, encephalitis is like an inflammatory response where your body is fighting the foreign objects that have entered into their system, and then some of the cells become inflamed, and then this triggers like a cytokine storm. It's called a cytokine storm. So this is more neuroscience terminology. And this is what makes your child uncomfortable. Your child can have a reaction. Your child can have a shock, or almost like an epileptic shock. The words, almost like an epileptic shock or an anaphylactic. Oh goodness me, anaphylactic shock. This is why I don't like medicine. The terms are like they want a tongue twist. So sometimes these same vaccines, the ones with these toxins, can cause seizures as well. And that is a common characteristic in some children on the autism spectrum. And the same vaccines can cause immune system deficiencies, gastrointestinal damage. Now, guys, I know this is deep. This is deep stuff. The gut system in the stomach, the gut, it is damaged by these toxins. It's damaged by aluminum, by mercury. It causes so much damage. This is why a lot they don't mention this when they are trained, even in the master's level. They do not teach this in their degree level programs in autism. They do not teach the fact that a lot of children will have gut problems as a result of the toxins that that were ingested at some point. They don't talk about it. They want to present their side as clean, like this thing just happens, like your DNA has some kind of a problem, like maybe you inherited it, it's genetic. This is the narrative, this is what is being trained in the education system. This is what we are told through our education system, that is genetics, is a pre-genetic disposition. They are saying that your DNA is faulty, you inherited this before you were born. That's what they're telling us. However, sometimes when you trace in your family, you will see that there is no history of this. And the same toxins can cause mood swings. So even if you don't have autism, you might have just mood swings. Don't think that it's only the people who are classed as autism who are affected by these toxins. Sometimes your immune system is compromised, just as it is. You might not even have the diagnosis of autism, but you will have other presentations that are affecting you, like mood swings, extreme pain, and you don't know where the pain is coming from. The encephalitis, can cause mood swings. That's the inflammation happening inside your body, your immune system, your body, your cells. The encephalitis, which is the inflammation, again, it causes pain, extreme pain. And sometimes it can be exhibited in an autistic child, and then they are having what they call a meltdown. A meltdown, and you just cannot get to the bottom of it. And sometimes it happens in episodes. So 1 minute they were fine, a moment ago they were fine, but just like an hour later, all of a sudden, from nowhere, they're presenting as if they're in extreme pain. They could like curl up, into a fetal position. They can start biting themselves. They can start doing certain behaviors that are socially unacceptable. Then that same inflammation or encephalitis can cause inattention, failing to pay attention, to give attention, to be attentive, and impulsivity and aggression. And these are common traits also in autism. Then when we look at seizures cause mood swings. They cause inattention and impulsivity and alterations in consciousness. This is one of the worst things to happen to a child, is for a child to start having seizures or epileptic fits. It's not comfortable for the child. It could result to serious outcomes. It's the last thing any parent, is the last thing anyone wants to experience. I mean, it's hard enough dealing with one problem that your child is presenting with these and this and this, and then to top it up, your child now has seizures. Then the guys, the gastrointestinal damage. This is a major problem, because you're going to deal with things like constipation. You're going to deal with, they say it's possibly pathogenic yeast overgrowth, and that leads to constipation, food allergies, skin eruptions like eczema, carbohydrate cravings. These are a lot of the presentations that you will find in an autistic child. So I don't know what they're teaching people about what autism is, because there's another autism which has nothing of what I said. So I don't know. It means there's two types of autism. There's the one presenting with all these things here, or one, like a number of these, not necessarily all of them, but you can pick something from here. Then there's the other autism where if you have nothing here, then I don't know what that is, because they say it's autism, but I don't know. How could it be the same thing? Sometimes the children can't even express themselves. Sometimes the children are nonverbal. Sometimes the children can't, they can't express themselves. They can't even learn sign language. They sometimes try to learn like this, it's sort of like a sign language. It's called Makaton. Oh, so yeah, guys, I mean, it is two of the, they call it, some people say they have autism, but they present with none of the characteristics that I've said. So I don't know what that is. I don't know. The issue is with the diagnostic criteria. So I know the world generally has accepted the diagnostic criteria from America, which there's two. There's the one from America by the American Psychiatric Association, and then there's the one from the World Health Organization, if I'm correct. Correct me if I'm wrong. If it was a long time ago, so I might have forgotten, but I'm sure it's the World Health Organization. And they set up another diagnostic criteria, which is the ICD-10, or no, ICD-11 now, and that's used worldwide. But generally, some people still adopt the American one from the DSM-5. So these are like diagnostic criteria that sort of guide how autism is supposed to be diagnosed. However, these diagnostic criteria, they're not accurate. They can be questioned. They can be challenged. Because I feel that they do not meet. Already we have this division between the people who have these symptoms, these presentations that I have mentioned, and the ones who don't have any of those presentations. Therefore, I think you need to revisit the diagnostic criteria and really let's come clean. Let's talk. Let's be open and transparent, rather than this whole thing that's going on where there is an elephant in the room that nobody seems to want to talk about in the mainstream or in the medical institutions. You guys, anyway, I don't want to touch on that too much. So I want to talk about the two main ones which I've looked at right now. They seem to be sort of being talked about much, which is folate. Or should I just stop and do another video, because I think this might be overwhelming. This might be a bit too much. Let me do this. Let me stop here, and then I will do another video and talk about folate as well as glutathione. I want to go into detail on folate and glutathione in an autistic child, relating to speech and language and general development. Okay, thanks. Bye. Please let me know what you think about these videos, if it's something that is adding any value to. Thank you.